All right, welcome to The Explainer. Today, we're pulling back the curtain on something that happens millions of times a day but is rarely seen: the incredible, high-stakes science of giving medications safely.
When you see a nurse give a pill or start an IV, it can look pretty routine, right? But what you're not seeing is this incredibly complex system of checks and techniques, all designed for one single purpose: to protect the patient. So let's dive into this hidden world.
And this really sets the stage for us. The stakes couldn't be any higher. This isn't just about following a list of rules. It's about building this invisible fortress of safety around every single dose of medication that's ever given.
So, first things first, before any medication, and I mean any medication, no matter how simple it seems, is given, every single healthcare professional follows what is basically a universal safety code. This is the absolute bedrock of everything else we're going to talk about.
Think of this as a safety net with triple redundancy. The nurse is going to check the medication label against the doctor's order 3 separate times at 3 totally different moments. First, when they pull it from the dispenser. Second, while they're preparing it. And third, right at the patient's bedside. It's a simple idea, but it's so powerful for catching an error before it has any chance of happening.
And during each of those 3 checks, what are they confirming? Well, they're running through this mental checklist, the 7 rights. Is this the right patient? Is it the right medication at the right dose? Is this the right way to give it at the right time? It forces this critical pause to make sure every single detail is perfect.
Now, here's where it gets really cool, because this level of precision applies to even the simplest things, like eardrops. So an adult's ear canal is shaped differently than a small child's. To straighten it out so the medicine can actually get to the eardrum, you have to pull the ear up and back for an adult, but down and back for a child under 3. It's such a tiny detail, but it makes all the difference in whether the medicine actually works. And it's the same idea with eye drops. You never, ever drop them directly onto the cornea, the surface of the eyeball. I mean, think about it. It's incredibly sensitive, it would sting, the person would blink, and you'd waste the dose. So instead, you gently pull down the lower lid, which creates this little pocket, that's the conjunctival sac, and you place the drop right in there. It's all about technique.
Okay, but what happens when a patient can't just swallow a pill? Well, this is where the procedures start to get a lot more complex, and those safety checks become even more critical.
When you're giving medicine through a feeding tube, the absolute biggest fear is that the end of the tube has accidentally moved into the lungs instead of the stomach. So, before every single dose, the nurse draws back a little fluid and tests its pH. If the pH is less than 5, it's acidic. Phew, you're in the stomach. If it's higher, you stop everything immediately. That one simple test prevents what could be a fatal mistake.
Now this is a huge one. Some pills have these really clever special coatings on them that are designed to release the medicine super slowly, over maybe 12 or even 24 hours. If you crush one of those pills, you completely destroy that slow release mechanism. The patient gets that entire day's worth of medicine all at once. It's a massive overdose hiding in what looks like a totally harmless action. This is a perfect example of how different tools need completely opposite techniques. The regular MDI puffer has a propellant mixed in with the medicine, so you have to shake it up, and then you breathe in slowly and deeply to get it all in. But the dry powder inhaler, the DPI, has no propellant. It's just powder. So you must not shake it, and you have to breathe in really fast and deep to have enough force to pull the powder down into your lungs. Totally different.
And the order matters too. You always use the bronchodilator, that's the rescue inhaler, first. Why? Well, think of it like a snowplow for your airways. It goes in first and opens everything up, clearing a wide path so the second medicine, the steroid, can travel much deeper into the lungs to do its job. And another thing, after any steroid inhaler, you have to rinse your mouth out. It prevents a nasty oral fungal infection called thrush.
Okay, now we're getting into injections. The second we break the body's main line of defense, the skin, the rules of sterility and preparation get even more intense. Just look at the difference here. An ampule is this little sealed glass container that you literally have to snap open. Now, to make sure you don't accidentally inject microscopic shards of glass, you must use a special filter needle to draw up the medicine. A vial, on the other hand, is a closed system with a rubber top. If you just pull medicine out, you'll create a vacuum. So you first have to inject an equal amount of air in to equalize the pressure. It's all about physics.
Mixing insulin is like a carefully choreographed dance, and it has one unbreakable rule: clear before cloudy. You have your fast-acting clear insulin and your longer-acting cloudy insulin. The sequence is so strict because you cannot risk getting any of the cloudy insulin into the clear insulin's vial. If you did, it would contaminate the whole vial and change how that fast-acting insulin works for every future dose.
The Z-Track method is such a clever piece of engineering. Before you inject, you pull the skin and the tissue underneath to the side. Then you give the shot, pull the needle out, and only then do you let go of the skin. The tissue slides back into place, creating this zigzag path that seals itself off. It's like a self-sealing gate that locks irritating medicine deep in the muscle so it can't leak back out and cause pain.
And now, we've arrived at the most high-stakes route of all, putting medication directly into the bloodstream. This is where precision is measured in seconds, and the safety protocols are absolutely non-negotiable.
I mean, this quote just says everything, doesn't it? There is no undo button. There is no recall. Once that medication hits the vein, its effects are immediate and, more importantly, they are irreversible. This is exactly why the entire process is so deliberate, so careful, so controlled.
For a direct IV push, nurses use the SAS method. Saline, administer saline. First, a saline flush to make sure the IV line is open and working. Then you administer the drug. And this is the critical part. You do it slowly, literally timed with the watch. If the book says push over 2 minutes, it means for 120 seconds. And then you finish with one last saline flush. So that brings us to a really important question. If you just slowly push the medication in over 2 minutes, how fast should you push that final saline flush? Should you just slam it in, push it over 10 seconds, or something else entirely? What do you think?
The answer is, you have to push that final flush at the exact same rate, over 2 minutes. And here's the crucial reason why. There's still medication sitting inside the IV tubing itself in what's called the dead space. If you push that final flush in fast, you're essentially slamming the rest of that drug into the patient's vein all at once. It's an accidental overdose, hiding in plain sight.
So let's quickly break down the two main ways IV meds are given. You have the IV push, which is that small, concentrated dose we just talked about, given over just a few minutes. Then you have the IV piggyback. That's a bigger bag of diluted medicine that drips in slowly, and it literally hangs higher than the main IV bag, so gravity makes it run in first. Each has its own risks. Pushing too fast can cause speed shock, but for piggybacks, you have to be 100% certain the two drugs are compatible.
And that leads to this, the final safety net. Before any infusion starts, there's one last mental checklist. This mnemonic, CATS PRR, covers everything from compatibilities and allergies to making sure the pump is set to the right rate and that all the clamps are actually released. It is the final, non-negotiable guardrail before that medicine starts flowing.
So in the end, you see, the most important tool in medication safety isn't a syringe or a pill cup. It's the knowledge. It's the critical thinking. It is the why behind every single tiny action. It's a completely invisible system, but it's a system that saves lives every single day.